Welcome to my public awareness talk series. September month is declared as National Polycystic Ovarian Syndrome Awareness Month, wherein information regarding PCOS is propagated, highlighting that PCOS is the commonest female endocrine disease in the reproductive age group and is on rise and is preventable. PCOS is of public importance as the incidence and prevalence is increasing due to change in the lifestyle. Moreover, PCOS has short-term and long-term implications in health, which can really affect the quality of life. The best part is PCOS can be prevented or symptoms can be improved or reversed if lifestyle modifications are taken seriously by the affected people. Hence, various programs are conducted with public interest to motivate the public to take initiative in this. Right thinking and right action are the ultimate solution for any problem and is so appropriate in dealing any medical illness, so also in polycystic ovarian syndrome. In the treatment of polycystic ovaries, major part lies in the hands of patients, so very important to enrich their knowledge about polycystic ovaries. Let us understand what is polycystic ovaries. Here is a picture which tells the normal ovary or which shows the normal ovary on the left side and the polycystic ovary on the right side. The normal ovary is about 3 into 2 centimeters and has got millions of eggs, but in general, every month it is only one egg which grows, matures, ovulate, and that is a normal scenario. In polycystic ovaries, you have many eggs, but most of them are immature. They do not show the stages of development, so that you have all atretic follicles or the immature follicles arranged in the periphery of the ovary, which gives the appearance of a necklace pattern, which you can see in the bottom figure. So let's understand what is polycystic ovarian syndrome. Polycystic ovarian syndrome can have many symptoms, and not necessarily all the symptoms that I am mentioning is going to be there. Some may have only 2 symptoms, some may have all the symptoms, but in general, what are the symptoms that we find in PCOS are oligomenorrhea, which refers to delayed periods, wherein the period can come anytime after 35 days. And the absence of periods, that is, period may not come for 2 to 3 months, which is called amenorrhea. And they may have menstrual irregularities in terms of early periods, late periods, scanty flow and the heavy flow and the irregular spotting. And polycystic ovarian people can have, in fact majority of them will have an ovulation, because of which they will have subfertility and infertility. They will have features of excess male hormones, which is called hyperandrogenism, which can manifest in the form of acne, excess hair growth on the face, obesity, and the hair loss on the scalp, and the pigmentation, which is usually seen on the underarms and on the back of the neck and in the groin area. When you do the scan, you find that there is a pearl necklace pattern which I described earlier, which is otherwise called polymicrocystic appearance. Let us try to understand what is the importance of PCOS in clinical practice, which is of public health importance. It is said that 80 to 90% of the people who come with delayed periods have polycystic ovaries. 30 to 40% of the people who come with not getting periods have polycystic ovaries. 90 to 95% of the people who walk into the infertility clinic and have been found to have an ovulation are having polycystic ovarian syndrome. 80% of the people who come with excess hair growth have polycystic ovarian syndrome, and 70% of the people who have alopecia areata can have polycystic ovarian syndrome. Let us see how common is polycystic ovary syndrome. It is commonly seen in the women of reproductive age group. In fact, this is the commonest endocrine disorder seen in this age group and accounts for 5 to 10%. That means if I have 10 women of the age group between 15 to 45, one will have polycystic ovarian syndrome. And it is a chronic condition, which means that it takes long time to manifest the symptoms. So it's a very important thing for to understand the treatment, because it takes long time to recover from the condition, and this may not be permanent, because there is a strong myth that once you get polycystic ovary syndrome you have to live with it. It is not so, but the thing is, it can disappear, but definitely it can recur. What are the causes for polycystic ovaries? It is said that it is multifactorial. The genetic factors, environmental factors, and the stress factors plays a very important role. It is inherited as autosomal dominant condition and has both maternal and paternal type of inheritance. And usually the patient with polycystic ovarian syndrome will have her mother and a sister also having polycystic ovarian syndrome, and on the paternal side usually we find the obesity, hypertension and diabetes. The environmental factors, which refers to diet and exercise, are really important, and if they have a good environmental factors or the safe environmental factors in terms of good diet and a good physical activity, they can suppress the expression of the genetic factors. And of course the stress factors also plays a very important role, and it is the commonest cause for rise in the incidence of polycystic ovarian syndrome in the recent years. Polycystic ovarian syndrome is also associated with other conditions like hypothyroidism, hyperprolactinemia, impaired glucose tolerance, dyslipidemia, obesity, and hypertension. What is the impact of polycystic ovaries? Why we are worried about polycystic ovaries? Because it has got a long-term as well as a short-term impact on the health, affecting the quality of health. It affects the mental health and also the emotional health. Mainly it is said that the obesity, excess hair growth and the infertility has a strong psychological impact, which makes the person to feel low or anxious or irritated or depressed, and they will have eating disorders and they will have sleeping disorders, and they try to withdraw themselves from the family members and the friends, so that also affects the social health. As you all know that health is not merely the absence of disease, and WHO defines health as a state of physical, mental, emotional, social and spiritual well-being. And people with PCOS may have difficulty in conception, and those who manage to get pregnant have been noticed to have increased incidence of abortion, gestational diabetes, pregnancy-induced hypertension and intrauterine growth restriction. And people who get GDM during pregnancy can develop a diabetes after the age of 40 years. 35% of the people are said to develop impaired glucose tolerance after the age of 40 years. 70% of people with PCOS can have dyslipidemia, and 50 to 60% of them will have central obesity. PCOS people are prone for hypertension, cardiac and cerebrovascular disease, and they are also prone for fatty liver and endometrial hyperplasia, which is a pre-malignant condition and can lead to endometrial neoplasia. How to diagnose polycystic ovaries? So it's on the basis of symptoms, signs, blood test and ultrasound scan. Symptoms I have described already. They will have high BMI or they can have a very low BMI, the normal BMI being 18.5 to 24.9. Actually, PCOS people can be obese or they can be lean, that I will be telling later. And the blood test includes high level of free testosterone, fasting sugar may be high, and the ratio of fasting sugar and fasting insulin may be more than 4.5. TSH, prolactin level may be impaired, AMH level will be very high, and the vitamin D level may be low, and the ratio of LH and FSH will be usually more than 2.5. They will have an impaired glucose tolerance test and an abnormal lipid profile. Ultrasound scan shows a small follicle size of less than 10 millimeters but are more in number, more than 12. It is very important to exclude the other causes of obesity, excess hair growth, and acne, which includes Cushing syndrome, congenital adrenal hyperplasia, androgen-producing tumors, drug-induced causes, hypothyroidism, and hyperprolactinemia. So the treatment for polycystic ovaries is mainly the triad, that is diet, exercise and distressing activities, which lies in the hands of patients, and of course the medical treatment will be given by the treating doctors. So PCOS people have to include frequent regular small feeds, which is very important, which is low calorie food containing complex carbohydrates, rich in fiber and low glycemic index food of less than 50, which is rich in omega fatty acids, and good hydration is very important. It's very important to include lot of antioxidants and low fat milk or curd. Please exclude infrequent irregular eating, which is high in calories, and refined bakery food and food which has very high glycemic index, and exclude fast food, cool drinks and beer. Ideal PCOD diet per day is 50% of the calories should come from carbohydrate, 30% from fat, 20% from protein, plus 2 to 3 liters of water. So it's very important that you include 5 fresh fruits every day, 5 vegetables every day, handful of nuts, cereals of low glycemic index, which includes brown rice, whole wheat, wheat germ, oat bran. And it is said that most of the fruits have got less glycemic index other than watermelon, pineapple, mango and strawberry. And vegetables which have got less glycemic index are legumes, beans, tofu, tomato and greens. And if you prefer to eat non-veg, go for the boiled items rather than the fried items, and prefer egg and fish over the red meat. Ideal exercise for PCOS is a moderate exercise of 30 minutes 5 days a week, vigorous exercises of 20 minutes 2 days a week, and strengthening and resistance exercises 2 days a week is very important and good in reducing the weight. So the de-stressing activities are mainly walking, yogasana, pranayama and positive psychology. All these are supposed to increase the level of happy hormones in the body, thereby the stress levels will disappear from the stress levels will come down. So positive psychology comes only consciously, and the 3 important things that you have to adopt in building positive psychology are love, faith and hope. Love, you have to love yourself and you have to love others, and an important tool to love yourself is to practice gratitude. Feel good for what you have, and important tool to love others is to practice forgiveness, and have faith in yourself and faith in somebody who is caring for you, and always have a hope in what you are doing, and a hope comes from spiritual practices. So it is very important that you take affirmation saying that I will always have hope when you are treating or when you are undertaking treatment for polycystic ovaries. So a small note on lean PCOS, because not that all people with PCOS are obese, 20 to 30% are lean, and these people will have high level of LH and endorphins, and are prone for hypoglycemia, and they have increased insulin sensitivity. Because of that, they will have normal fasting insulin. They are also associated with increased androgens and DHEAS, because of which there is an increased metabolic state, so they remain lean. However, they have to practice strengthening exercises, and they have to practice de-stress with the help of the tools that I mentioned before, and they have to take high protein diet, less fat, less carbohydrate. Medical treatment includes mainly vitamin D and myo-inositol. Pharmacotherapy or the medication in polycystic ovaries is targeted mainly to the symptoms, depending on what symptom they have. If they have heavy bleeding, the hormones are given accordingly, and if they have anovulation, again the ovulation induction drugs are given accordingly. And the other 2 important medicines in the treatment of polycystic ovaries are metformin and inositols, which are supposed to increase the insulin sensitivity, or in other words decreases the insulin resistance, and supposed to help in controlling the regularity of the menstrual periods and the fertility and so on. Myths about PCOS are: People think that it's a permanent disorder because it is genetically predisposed. Not at all. In fact, you can win over the genetical factors if you have a healthy environmental factors, because you can suppress the expression of the genetic factors. And there is a myth that it is always hereditary, which is not so, because I said already the environmental and stress factors plays an important role. There is a myth saying that it is irreversible. Not at all. And there is a myth saying that you expect immediate response to the treatment, which is also not true. And once treated, it should not recur. That is also wrong. It can recur because again, if you start eating and if you stop doing exercises, if you put on weight, the PCOS can recur. And there is a myth saying that if you have PCOS, you can never conceive. It is not at all like that. And there is also a myth that I don't want to start hormones because hormones are bad. It is not like that. PCOS is an hormone imbalance condition, so you need to take the hormones to make it balanced. And there are very, very low dose hormone pills which will definitely help in especially controlling your symptoms. So I conclude this talk by wishing all the lovely daughters a happy Daughters' Day, which is celebrated on 4th Sunday of September every year. So it's very important to embrace daughters who are the gift of life and a gift of love, and it's very important to empower them, enrich their knowledge and make them independent. All that is possible only if they remain healthy and keep their health in a very good condition. Thank you very much.